Good evening, everybody. I think um, I introduced this particular session by saying that the issue in 2023, if you have to choose the event that we'll remember for the year, it's October the 7th, and we don't have any choice of any other date, either in Israel or indeed throughout the Jewish world, and possibly even wider than that. I'm We're very fortunate in that we've got an excellent shadchan in Israel who is called Yehuda Ginosar, but was known by another name when he was based in the UK many years ago. And I want to thank him for being of enormous help to us in setting up this particular webinar. He works what is called as an anaesthetist in Britain and an anesthesiologist in the United States, I think. And he's introduced us to somebody who works with him and who's also, as I've mentioned, an American originally, but who's been in Israel for a number of years and who played a unique and distinctive role in the events of October the 7th. And we're very privileged that we've got the opportunity to hear him tonight. So you're not here to hear me, you're here to hear him talk. As is customary with these webinars, please put your questions and answers, questions for answer into the Q&A block. And also, you can also fill in comments on the chat. And when we've heard from Shlomo, we will then have an opportunity to put some of these questions to him again, as is customary within the context of the webinars. Shlomo.
Okay, so first of all, I want to thank everyone for hosting me here. I think this is something that's important to be heard. These are events that were definitely very formative events within the Jewish nation and within medicine as well, in twofold. Number one is in the Jewish nation as a very traumatic experience. Within that traumatic experience, the unifying experience that happened, and also there were a decent amount of good lessons learned in ways of dealing with patients that are trauma patients from the beginning in the pre-hospital setting all the way to within the hospital and thereafter. And I think one of the positions that I fell into on fortunately unfortunately was seeing the whole spectrum from the pre-hospital setting where the injuries occurred all the way to treating them in the ICU and then seeing, thank God, some of them released in decent condition. But I'll go through a little bit of the events to bring you through a little bit, of the experiences that I experienced on October 7th. Just to give a little bit of background of who I am, my name is Dr. Shlomo Gensler. I have the privilege to work with Yehuda Ginosar in Hadassah in the anesthesia department. I'm an anesthesia resident. I've been doing, for many years, I've been a part of, emergency medical services in the United States, first working in 911. And then afterwards, when I became a physician, I was part of United Hatzalah, which I currently am a part of them. I have an intensive care Jeep, a mobile intensive care Jeep with all the bells and whistles of what we would try to do to bring the hospital to the street. And it's a unique position that are able to, administer some extra advanced life support care within the street. So basically, leading up to October 7th, I would always respond. I've responded to many, many terrorist attacks within Jerusalem area and beyond. And I've also, been very involved with whether it's their training and also just the general regular calls within the Jerusalem area. October 7th is something that will ring clear, starting with the sirens that started early on Saturday morning. And at first we've experienced it before, having alarms come off. And so I was at the Beit Knesset at the synagogue with my family, and we've heard the first siren come in. So initially, they obviously on the radio. I'm always on call on Saturdays, and I go on lots of calls to help out within the Jerusalem area. And I initially got a phone call right away asking if I'd be willing to assist, giving advice to people that were trapped down in the Gaza border region. So that was like the first initial, like, inclination that something is a little up beyond the regular routine, what we've had in the past, these kind of alarms. What ended up happening is I agreed to, give advice, to medical advice to people in that area. And what happened was I got a message, stating to call the daughter of an individual who was hit by an RPG, which is a rocket propelled grenade, that he was missing his arms and his legs. And I'm sorry if it's a bit graphic. I think we're all medical professionals, but I'll give a little bit more of the graphics over here to better understand it. That he was a person who was losing consciousness, and he had multiple wounds to his thorax. I picked up the phone and I gave a call, and she said, "Listen, we've been sitting here for a few hours. We're sitting inside the mamad, which is the protective room. We need transport to get to get my father to the hospital because he's losing consciousness and he's lost quite a bit of blood." I At that point, hearing what was going on, I decided to call I said I'd call them right back. I called the Army hotline to basically see if there was anything that they could help, because I understood there was fighting at that point going on. I called the Army, and the response I got is something that really like shocked me and got me to understand the gravity of the situation. I spoke to the person from the military, and they said, like, I explained them the situation. They're like, "I'm so sorry. We're just not able to help right now. We're not in control." And to hear that coming from what we understand, the Israeli army, which is a pretty powerful army, and the understanding that the area that we were, like Israel being under attack, and then starting to hear that trickle by trickle that there were villages that were taken over. We got to I, that really started to settle in, and basically after that, I had to call back the family, and I was going to tell them, go make a run for it, see if you can get out. And but when she picked up the phone again, I was able to hear rapid gunfire like behind, and she said, "Listen, there's fighting going on right outside of our safe room. We're unable to go anywhere." And I had to tell her, "I'm so sorry. We're going to try to get help to you as soon as possible, but at this moment, there's no civilian ambulances that are able to get there." And I had to leave it at that. Shortly after that, and this is all when I was sitting outside with my family outside of the Beit Knesset, and I got a call from them asking if I would be willing to come. There's hundreds of injured. Would I be willing to come down towards the Gaza border region to try to help out a little bit with rendering medical care? So I had to obviously speak to my wife and make sure that she would be okay with it. Obviously, understanding we're under attack. Obviously, being able to understand we're under attack, and understanding that this is something more than just a regular run of the mill rescue case. My wife obviously realized this is our nation that's under attack, and she said right away, gear up and get ready to go. I brought with me another emergency medical technician, and we drove down, lights and sirens, going straight down to the border region. I literally, what normally takes like about an hour and a half to get there, I think it flew by really, really fast, and I got there like within 40 minutes. So the whole thing is initially getting the phone call about like 8:30 in the morning, and arriving down about noon to the area is called Somet Cheletz, which is like an area right outside of Sderot. It was in like a field, which was the staging point. And there we got to start to experience like what real war was like. There were missiles flying. You were able to see the missiles coming, like streaking through the sky, and you would see the Iron Dome batteries start firing back. The United Hatzalah staging point was over there, and we basically like geared up, and I had our like bulletproof vests, our helmets, and we understood like obviously there's only a limit to what that could actually help us. because what we understood that they had rocket propelled grenades and they were using heavy machine gun fire. The terrorists that had infiltrated. So we geared up and then we got basically ready to go in. There was like that one. There was a checkpoint over there, just to give a little bit of understanding. There was a checkpoint where they said, beyond this, we can't guarantee your safety. And they said, they asked us, because always one of the big tenets in medical, pre-hospital care is don't put yourself at risk before, when you're trying to help other people. But we realized that, our nation was under attack and there was not much, at that point, there were a lot of injured from what we heard, the reports that were coming. So we decided at that, they asked us if we'd be willing to go in and assist people. So we drove in towards the Sderot. And at that point, like we weren't really prepared for what we were going to see. But in the first experience that we saw a group of soldiers like hanging over like what appeared to be a body. So we quickly made a U-turn. It was on the other side of the road. We pulled over. I see this man laying face down. He had been driving an electric scooter, and it was like a security guard. We saw that he was face down, so we wanted to see if we could render any care to help him. We obviously saw that once we got close enough, we saw there were multiple shell casings all around him, and that he'd obviously been executed. We were able to see multiple entry points. We flipped him over to see if there's anything we can do, and we saw a large exit wound coming out of his eye. So we knew at that point that there was really nothing we can do. But being naive at that point to what the carnage we were going to experience afterwards, we decided in the intensive care Jeep, there's a ability to put a stretcher. So we collected we put his body in and brought him back to the staging point. After that, we decided to go back in. We went further past Sderot, turning onto a road going towards the city of Netivot. And that's where the real carnage that we got to experience. And we basically saw cars at the initial turn off in this big interchange. We saw multiple cars shot up, people hanging out of their bodies hanging out of cars. There's one image that sticks in my mind, and that was like the first initial experience. I saw this car like crashed off to the side, and you could see the person was obviously trying to get out of the car, and they were executed like that. And it was something that really stuck with me. And even after that, when I went back, once they had cleared everything out later on, I went down like a couple weeks later, you could see the memorial there. But in my mind is that etched image of somebody trying to run for their life and being, mowed down in a very barbaric way. But basically that whole drive from Sderot to Netivot was basically like going on a zigzag down a major highway, car after car, people executed in their cars, people executed outside of their cars, people trying to escape, and piles of bodies. And it was that at that point we understood that it started to dawn upon us, not only was this like, rocket attacks and things that we've never seen before, but it was a real carnage, like a really barbaric and horrific experience to be able to see. We drove all the way down to Netivot. Once we got to Netivot, we were trying to, at that point we realized we're not going to pick up any more bodies, and we need to start looking for the injured and trying to help as many injured individuals as we could. So at that point, we basically we got to this one of these checkpoints at the outskirts of Netivot, where it just started to come in waves and waves and waves, injured individuals, and people were basically, at that point, the only people that were willing to go in was United Hatzalah. At that point, the Magen David Adom was not willing. They had already had an ambulance that was shot up, and they were not willing to send their crews in. So the civilians were basically putting people on the back of pickup trucks in their cars. Army trucks just kept coming at us, and we decided to set up an area that we would start to treat them. And we were starting to experience like all the things that normally you would experience at a terrorist attack here in Jerusalem, 1 or 2 or 3 people. Here you were experiencing them already in the hundreds. And we were getting people that were shot in the head that were still alive at that point. We were getting people that were shot in their limbs. And you know, many people with tourniquets, which is a discussion that I'll come back to later on in this in this talk. But it was something that was, you were able to see, you know, the real horrors of war. And I'll give a few different examples of things that were happening. So the police, this was at the edge of Netivot, and so as I was saying, there was a lot of rocket attacks. So where we set up, about 2 blocks away, as we were treating people, a rocket fell that was not intercepted by the Iron Dome, and there was this massive explosion right like 2 blocks away from us. And you can see, we were able to see further down from a checkpoint, one of the police cars that was taken over by Hamas terrorists, and they got into a firefight with the police shortly before we arrived, and they were able to neutralize them. But the police had set up a checkpoint there. You know, no one was sure which direction, you know, people would come from. And there were consistent things, what they would say, chadirot mechablim, which means, you know, the terrorists infiltrating, and there would be all this news of which direction it would be coming from. And like, you know, at that, like, so everyone would just have to keep on being fluid, ready to move as soon as, you know, if there would be like a threat that would just present itself. So there we basically, I set up at that point like three stretchers where we started to receive soldiers and civilians, and basically started to do triaging. So this was at the edge of Netivot. It was about, like, we got there about 12:30, and we just started to treat. And our goal was to, you know, see if we can treat any emergency life-threatening things there at that point, and after that try to ship them off to the hospital, whether it was by, you know, basic life support ambulance, advanced life support ambulance, or by helicopters that my organization had, and by military helicopters. So at that point we started, like, what came as a shock to me was to see the soldiers that kept coming at us. And a lot of them, I still, one situation sticks in my mind is, you know, one of the soldiers came running at me, and he said he was crying, and he was saying that he had his best friend die in his arms, and that experience to him, and he was so traumatized and unable to do anything. It really started to resonate, and they were basically saying, you know, you know, they were saying we were caught with our pants down. We were just not able, you know, to say it in the most clean language possible, that they were just ill prepared for what happened. And at that point, like, you know, you know, I always pictured it, you know, I've always seen movies of, like, you know, Saving Private Ryan, you know, where a movie where somebody, like, you know, was shell shocked and you couldn't speak to them because they couldn't hear anything. I still remember one individual who was he was shot in his arm, and I was trying to ask him, "Are you in pain or not?" He couldn't hear anything. I kept talking to him, and it sounded like he was ignoring me. And then I realized he couldn't hear anything I was saying, so I had to start screaming to him to be able to hear. And these are like the small little incidents. But during that time, we were there. We spent a good few hours there. But as the fighting continued, we were able to advance a little bit more to an area called Shuva. So this is the main road that leads down to all those border villages, along which is Be'eri, Kfar Aza, Re'em, like all these all these villages along that really got hit hard. So at that point, we set up like in Shuva a real we hit the logistics center from our organization. We set up like a larger amount of equipment, of basic life support and advanced life support equipment, together with the army, because the army unfortunately did not have enough assets to be able to transport all these critically injured patients to hospital. And so we set up a helipad where there's a unit that I'm sure some of you are aware of. It's called 669, which is a combat rescue unit. They set up we set up a landing pad right next to, in the field right next to us, to be able to transport all the critically injured patients straight to hospital. And at that point, we also were starting to render life-saving care to individuals that were coming in critical condition. And so at that, I was the only physician. I was the only physician for my organization there, but there was another physician, a family physician, who had done a decent amount of training in orthopedics beforehand, who was living in that area in Shuva, and we basically teamed up together where we started to do this, like, going from ambulance to ambulance as they would come, triaging them and like basically doing a rapid trauma assessment. And if any interventions that needed to be rendered, we would do it right there. So over there, I had to intubate numerous individuals, and also had to, do chest decompressions, and also give a lot of pain medication to individuals. So it was like a real experience of, where I also work in the hospital, and I'm able to experience, what it's like to be in the trauma bay. But this was like the trauma bay coming in, like, with an open faucet. And we throughout the night, I was there from 12:30 at night, 12:30 in the afternoon, all the way to the next morning at 7 a.m. Basically without stopping treating individuals. So it was just like a rapid fire of one after the other. And I told one of the people standing next to me, just make sure I just drink something and just eat something, just so that we keep on going, so we don't lose, and it would come in we don't lose energy, but it would come in these waves of, like, once they would free a whole set of hostages, there were a lot of people coming in. And the thing that I found interesting is that many times we always, like, say we need to treat people with advanced life support, for somebody who has a bullet injury. Here we were just shipping them in whatever asset we had available. And that would be basic life support ambulances, which are EMTs that have limited ability to treat individuals. I basically give them pain medication just to get them to hospital as fast as possible. But I also encountered immense bravery on the part of a lot of the soldiers. And there's a few of these situations that really stick with me. We got, like, when they lined up a bunch of soldiers, who were all somewhat what we'd call with severe injuries. One soldier turns and he's like, he looked over at the guy next to him and he said, take that guy before me because he's worse off than me. And that's something that really, it really resonated. First of all, the bravery of individuals going into rescue, and the willingness to really, go help other people in a time of need. But at the same time, we were able to see, like, it felt in a way like what I understood the Yom Kippur War to be. Where there were many soldiers. I'd ask them, I said, "Where's your unit?" And they'd be like, "I have no idea." And I'm like, and they would just come and help us out until they would be able to find their unit. And at that, like, what ended up happening, what we ended up understanding, is that a lot of the communication in the IDF was knocked out at that point. So everyone was just kind of communicating through our, like, in our channels. We were communicating like with individuals that we were sending ambulances into the area of Be'eri, and they were basically bringing to our staging point, all the people from all the villages to our staging point. And we were basically triaging them there and handing, like, if there was an ambulance for Magen David Adom, we were basically transferring them over to those ambulances to bring them to the hospital, and then sending Ichud Hatzalah ambulances back in. And it was a very surreal experience to be able to experience, like, to see, this consistent thing going on for, like, the entire night. And basically what ended up happening is we ended up driving into Be'eri and being always close to the fighting. And it was just very interesting. At first, there were so many missile attacks. First, we would always duck down onto the ground, like, as soon as each missile attack would come in. But after a while, it was so numerous that we just got used to it. And anybody that didn't have a helmet would go into these bomb shelters, and then we would like continue working as these missile attacks would happen. But the real military response, as we were there, only started to happen at nighttime, and we saw the tanks starting to roll in, and you were able to hear more of the army responding only later in the evening. So the whole Shabbat, like, when we were down there, it was just like basically trying to treat everything that kept coming at us until the military would be able to respond. And it was just there were some very interesting, very I would say very heart-wrenching experiences. We had a grandmother that came to us at this area in Shuva, who came up to us and she said, "I know my grandchildren are trapped in Kfar Aza, and they're hiding in a cupboard there in Kfar Aza. And if is there any way that you guys can help us get them out? You know, they don't know where their parents are, and so we basically contacted the army, and we told them she explained exactly where their house was in Kfar Aza, and the army, like about 40 minutes later, brought the kids over. They were able to rescue the kids from there. And when we first encountered the kids, we asked them, you know, like, how are you guys doing? And they said, you know, we saw our parents executed in front of us, and we're hungry. We haven't eaten in the last 12 hours. And at that time, I had been going on such, like, you know, adrenaline of going from patient to patient, but it brought to see new orphans and to see the humanity in them really brought like a new, like I had to walk away and, you know, cry a bit, come back, and then get back to work. But you're able to feel like, you know, even throughout all this adrenaline, to see humanity and people really, you know, really suffering. And I could say, unfortunately, I was, you know, also had to see some of the atrocities, which is like, you know, let's say bodies that were burnt alive, and you can see that they were they died very painful deaths in very contorted ways. They passed away. These are images that obviously stick in my head, as you know, things that I think, this is why, one of the reasons why I think this talk is so important to understand, is not just to talk about the horrific parts, but to understand what the Jewish nation has gone through, and how we have to say that this is completely unacceptable, you know, in our current times, and that this is not something that we should have to, you know, suffer through, and not something that we should stand for. And you know, the take basically after that, throughout the night, we drove further on to Be'eri to help out with more care. And during that time, the whole way through, I was able to see, you know, the driving through shrapnel. As my Jeep was driving through, I was able to hear the crunching under my car of, you know, driving over shrapnel. And there were some of our ambulances that had been hit by shrapnel and by bullets as well, when they were driving, and some of the people had encountered face to face, unfortunately, some of the terrorists. Thank God I was not shot at directly, but I was very extremely close to the fighting, and you know, I was able to encounter, you know, while I was in Be'eri, as I was driving there, they're one of the individuals that I work with in the hospital. He's also a doctor in one of the advanced units. So I was, you know, in the middle of the night, like 3 in the morning, driving there, and I just see the picture of his face, like, you know, in my headlights, as he's laying there back on the you know, on the ground, and you know, resting before the next entry. And it was just that, you know, you're seeing like these drastic things. You're in this, you know, a place that looks completely like a Holocaust. And that's the image that I thought of as I was driving down to Be'eri. I was able to see these villages, like everything on the way, just on fire, and like the pictures that I had in mind, the way the Holocaust looked as the Nazis were coming through and burning, you know, Jewish villages. That was a very similar view of how it looked at that time. And you were able to see cars blown up, turned upside down, bodies strewn all over the place. You know, at one point we almost drove. There's a place called Nachal Oz. We almost drove. It was very dark, and at night we drove. It was a bit scary because we ended up driving past, you know, one of the where all the military people were, and they quickly turned us around, because just shortly past that, it was completely a territory that the terrorists were in control of at that point. And so this was our whole night, where we basically were treating very severely wounded people. And even there was one case that comes to mind as well, a 90-year-old female who was shot in her chest. Thank God the bullet didn't penetrate any vital organs, that had just gone through her breast tissue, and she had an exit wound out of the other side. But you were able to see this was something that was done at close range, and much of this was extremely premeditated. And you know, it was something that really sits. I feel privileged that I had the opportunity to help people that day, and but at the same time, I think the world needs to hear firsthand of what we actually encountered. And it wasn't just me. There were many individuals who were willing, you know, from Ichud Hatzalah, and also from other organizations that were willing to put themselves in the line of fire when they realized, that our nation was in trouble. And following even these October 7th events, I work a lot in the ICU at Hadassah, and I got to experience and treat a lot of the wounded soldiers and wounded individuals, like civilians from the October 7th attack. So it was just a very surreal experience going from seeing, the patients that were severely wounded, in the field, and then sending them off to hospital, and then seeing them later in the hospital. And there were some very interesting take-home messages that I saw. And many individuals were, who had been wounded with gunshot wounds, and they were bleeding. Immediately, the inclination is to quickly stick on tourniquets. And this is something that there's been a lot of discussion here in the emergent, like pre-hospital setting, and as well in the hospital, as we're seeing a lot of the after effects of that. But many individuals weren't able to they had tourniquets on for over 12 hours because they had bullet wounds to their extremities. And, I was able to, the effects that we saw after that, in pre-hospital care, one of the things, immediately somebody has a gunshot wound, stick on a tourniquet and get them to the hospital. But this is one of the things that we didn't prepare for, was the inability, were people that were under, under like siege, that were unable to get out. And afterwards in the hospital, I was able to see many soldiers, unfortunately, that had to lose limbs as a result of limb ischemia, and also suffering of reperfusion injuries. But in the hospital, one of the things that much of what I encountered was extreme bravery. And it was extremely therapeutic for me to be able to, watch these people recovering from these, severe injuries. And, there's one soldier that it was shortly after I got back to the ICU. I was treating him, and he was a person that had, he was shot in the arm, and first he got hit by an RPG, like shrapnel of an RPG in his arm, as he was, fighting with his, he was fighting with his unit, and then he put on a tourniquet, and unfortunately, shortly after that, he was shot again a little higher up in his arm. So, and then he had to move the tourniquet a little bit higher. But this is, and then they retreated to an area to try to save as many people as he could. But one of his best friend was another he was a commander of his particular unit. His best friend was killed like right next to him, and he knew that the funeral was going to be in the next few hours. And like when I started to treat him in the hospital, and I overheard him talking to his father how important it would be for him to go. So I asked around, like I asked, one of the attending physicians there, was a good friend of mine, if it would be willing, if he thinks it would be a good idea if we could try to take him to the funeral, because it seems very important to him. So I was able to arrange he was stable enough, they were able to take him. So I accompanied him to Har Herzl for his best friend's funeral. And it was just a very, 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 I guess I would say, a therapeutic experience to see this soldier mourning his best friend, and also one of his own. We had back-to-back funerals, one after the other, of like one of his soldiers, and also his best friend that had passed away. And one of the things he said, he's like, he told his mother and father that were there with him, and he said, just let me be able to cry. And like, don't worry, crying is also a sign of bravery. I just need to mourn the loss of my friends. And that was something that was, for me, very I think, an important experience. And I think also it was able to remind me of the humanity in medicine, is that even if we're treating people, to remember the larger picture of our patients. But aside from that, one of the interesting things as well, that another experience within the hospital setting, is that they have the what we call the tal lachatz, which is I keep always forgetting the word, and at this point I've been long enough in Israel that I've been forgetting the word.
Hyperbaric oxygen chamber.
Exactly, the hyperbaric oxygen chamber. And it was basically, it looks like a little submarine that everyone's in, and so we'd basically pack in all the soldiers from the ICU. And it was just, it was remarkable to me, because they would all come in with their individual injuries and sit in there for 2 hours. and you know, basically relating. And it was just like this massive therapy session for every one of these soldiers. And I think a lot of them will walk out with a lot less PTSD because of that. But one of the ways for treating a lot of their injuries was basically to go into this hyperbaric chamber. And it was very interesting to watch the progression of them, like, you know, struggling with their conditions all the way that I've gotten to see many of these individuals being discharged. But one of the individuals that we had with us, unfortunately, he lost both of his legs as he had tourniquets on. But the bravery and the positivity that many of these people imbued was something that really stuck with me for a very long time. And it's something that sticks with me today. And we get to see many of them come back to the hospital. You know, they come back after they leave the intensive care. They're treated like for their burns or for, you know, any of the other things. And it's very heartwarming to see and be able to treat them. But one of the things that we also have to encounter, and I'm going to take questions as well afterwards, is the consistent trickle of the people that from after the October 7th that we have in the trauma bay coming into Hadassah, which is the wounded soldiers that are coming from Gaza. And it's something that, you know, every time our hearts sink as we know there's another helicopter coming in with like 3-4 wounded soldiers at a time. And one person that I was, you know, recently treating, and it's an individual that was in a tank that was hit directly by an RPG at close range, and the whole tank, you know, miraculously he made it. All 4 individuals inside made it out. But we're seeing a lot of severe burns, a lot of severe burns, a lot of upper respiratory issues afterwards, and a lot of other injuries that we otherwise didn't get to encounter on a regular basis. So this has definitely been a very big learning experience for all of us, and it's something that we wish we didn't have to have as much experience in. But it's something that I feel privileged to be here and be part of, first of all, such a wonderful department at Hadassah. And Hadassah, we've treated over 400 people at this point that were injured within this since October 7th. And we hope that this ends sometime in the near future, but I think this is something that we all need to know about and be willing to say that this, you know, enough. But the one thing I want on a medical note to talk about, as we said, is the length of time of the tourniquets. And this is something that we've discussed, as I told you before. We've had a lot of people that have like the consequences of long-term tourniquets, which is a lot of it is the reperfusion injury and the effects that it has on causing multi-organ failure, and many young individuals that we had to put on dialysis for quite a long time until their kidneys were hopefully able to recover. A lot of them were able to recover, but they were in very critical states due to their metabolic imbalances, due to, you know, these cytokine storms that would come after releasing, you know, basically causing toxicity from these reperfusion injuries. So it's something that, you know, obviously needs to be more investigated, much more of better approaches in the future. But it's something that definitely resonates, and we hope to improve ourselves on that area. But with that, I really appreciate the time, and if you guys have any questions to follow up on anything that I may have said, I'm open to it.
Firstly, you say that it's a privilege that you've been able to do this and you've been able to contribute in this kind of way. I think you've got it somewhat wrong. The privilege is ours because it's exceptionally rare that we get such a wonderful description, which is wonderful in a horrific sense, but a wonderful description of what happened. And the obvious question that has been posed before we go into other more detailed question is, how about you? How are you coping? And how are you coping with the experience, and how do you cope with the trauma, both physically and emotionally, of what's happening, and maybe what do your family have to say about it too?
Okay, so first of all, it's a great question, and it's something that I get asked a lot. So first of all, I have to say I have a great support system at home, and I have a wonderful wife who's extremely supportive, and she's a physician herself, so she definitely understands a lot of a lot of what it entails. And one thing I'm a big believer in is expressing the story, because I think that first of all, when I'm able to externalize, there's a few things. A lot of what when I've learned about PTSD, when I've done my psychiatry rotations, and I'm sure if there's psychiatrists here, they can chime in. But when something falls upon somebody and they feel a lot lack of control, it's much more traumatizing. I slowly got acclimated into it. I mean, it was not that slowly, but it escalated fairly fast. But I made the conscious choice to go down there. It wasn't something that fell upon me, and I had the opportunity when I was down there to consistently try and help. As I've seen many things like within the terror attacks that I treat. I've been on the phone, like on research things with Yehuda Ginosar, and saying I gotta go. There's a stabbing right around the corner, and that's something that I experienced. But this was the sheer gravity of seeing the lack of caring for a human life and those type of things. I think the sheer quantity of it was great, but I think also the ability to help other people was very strong. And I think I've been able to process it through doing, talking it over with many of my friends and talking it over with many of my colleagues, and also having to do many interviews that followed. So it gave a good opportunity to externalize the experience a little bit more.
Right. I mean, related to that, there are questions about your safety, about how far is Netivot exactly from the area that was most affected when you set up the station. What were the distances involved, and were you given any guarding, or were you given any safeguarding for yourselves? How are you protected within the complex that you described?
Okay, so we basically we all had United Hatzalah provided us all with, we have helmets and bulletproof vests, but obviously against any RPG, rocket propelled grenade or missile, that's really not sufficient, and we were aware of that. We were generally surrounded by the military or police or other armed individuals, but obviously we saw at that point many people were just there was only a limit to how much you could be protected down there. But the way we viewed it, and many of the individuals that were there, is, our nation's under attack, people need help. There's obviously a level of risk that we're willing to be able to take. It wasn't like, I wouldn't say that we were, sometimes they say the line between bravery and stupidity is quite thin, but I don't think that we tried to be very careful not to overdo it. There were individuals that did drive into very, very, active firefights in order to rescue people. There were those individuals, but we definitely tried to always stay within the confines of where we thought we would be able to be better protected. But it wasn't in our control always.
I mean, there's one question which is raised, which was raised in advance, and in fact is a question, is the feel for the IDF, the feel for the soldiers who had to go into these areas and so on, and the fact of how well were they equipped, and presumably there was deficiencies of information, but how were they equipped? Were they given sufficient safeguarding material, which you must have seen?
Okay, so I mean, at the beginning, everyone was caught very, very off guard, and you were able to see that. I mean, in terms of like the tanks only started to roll in at nighttime, and that was like way after the attack happened, and we were able to hear helicopter gunships above us, firing back, but we were able to see that there was we weren't able to no, there were so many assets that were taken over by the invading terrorists that it was very hard, you know, first of all, to know what to trust, what not to trust. And even with amongst, so you'd have a police car driving at you, but there were many police cars were hijacked by the terrorists. So you were never sure, even if you saw a police car coming at you, whether that was a safe police car or not. And every time, so everyone would have to slow down. And even when we drove from checkpoint to checkpoint, we would have to raise our arms, just to let them know that we pose no threat. So I think if it was at the beginning, the question about sufficient resources, I think everyone was just trying to piece things together because people over there did not anticipate the level of what ended up happening. So at the beginning, no one was well equipped enough, and that's the reason why generally the IDF is a very effective army, and they're able to be able to treat and even they have many fantastic physicians and fantastic medical care, but at that time they weren't able to hold the line, and that's where as the civilian emergency care was able to jump in and try to help. But if you're asking about equipment at the beginning, there was not enough.
Talking about equipment, there are medical questions that are raised, obviously. You intubated people. Were there ventilators that you could use for them?
So I happen to have I have a ventilator on my intensive care Jeep, but we generally, when we intubate in the field, the generally when we're transporting, we'll use an ambu bag, which is BVM, a bag mask. It's basically not, it's a BVM. It's an ambu bag that's basically, you'll ventilate them all the way to the hospital. It's just more effective. It depends. If they were going on a helicopter, they'll be put on a ventilator. But we had enough equipment. At that point, there was Ichud Hatzalah had a lot of equipment. A lot of the army paramedics were coming to us for equipment, and I'd be handing them laryngoscopes, intubation kits, and giving them like my thoracotomy kits as well, just because they were running out of equipment. And one of the things that I will say that we found, there's always been a lot of research lately in the pre-hospital setting about using blood products. And one of the things that we saw that became very invaluable, but not enough of, was fresh dry plasma. It was fresh dry plasma that you reconstitute it in the field with some saline, and then you're able to use it to give some much needed volume in people that are hypovolemic.
What about pain control? There's the story about people not that in massive trauma that the pain is not as big a problem, but how did you give the pain control, and how much was pain a problem?
So pain was a big problem. It was something that there were many individuals that had. I mean, the army had a lot of these fentanyl lollipops. So those were really, really helpful because you had a lot of people that they had massive injuries and they were smiling, happy with these lollipops sticking in their mouths. I mean, I could say the amount of ketamine I gave out there and fentanyl was very large quantities. I had to order some more. They drove some more down from Jerusalem in order to give, and that was something. It was basically giving them some decent pain control and shipping them off to the hospital to more definitive care as fast as possible. So obviously I'd establish IV access, give them some fentanyl, give them some ketamine, and then ship them off to the hospital.
I mean,
as far as pain control, do you want to speak about the pain control in the ICU with peripheral nerve blockade for some of the patients with the big fasciotomies?
So we would do that was actually, I mean, it was very interesting because we would do a lot of erector spinal blocks and also a lot of peripheral blocks where we would put in catheters that we were able to, we were trying to, obviously the goal is in the ICU is to try to get off opioids as fast as possible. So that was something that we were able to see a lot of that was very helpful within the intensive care. But obviously in the field, you don't have the time for that type of, the idea with a lot of traumas is pack and go as fast as you can and get to definitive surgery. But within the ICU, we had the luxury of being able to do a lot of very interesting, things that you learn in the textbook, and to be able to to be able to put them into action, putting them on, bupivacaine drips, to treat peripheral nerve blocks.
One of the issues that you mentioned is the question of the prolonged tourniquet use leading to excessive ischemia. Generally, what were the reasons for the delay? And Hadassah, how were people distributed distance closer to closer hospitals or further hospitals, that kind of thing?
Okay, so there were many people that were just physically. First of all, there were people that were trapped that were able to get, like, meaning there was too much fighting going along, and then there just became a problem. There was just no modality to transport these people. So there were people that were injured waiting for transport, and there just wasn't. So what ended up happening is we found out, like Ichud Hatzalah found out, that there were so many people that were basically just sitting in Kfar Aza, Be'eri, all those places that were sitting waiting for transport, and they just weren't coming. So we just sent our ambulances down there, and it's like what usually an ambulance is meant for 1-2 people. We were packing in 5-6 people into an ambulance and just bringing them out to our staging area. And if there was other ambulances available, we would transfer them over, and the Ichud Hatzalah ambulances would turn back around and go in and try to pick up more. But people had to wait, and that was something that was very, very painful to hear about in retrospect. And in terms of how people were distributed, so when they came to us, we would see if their people were unstable, we would send them in the helicopter, like Medivac, which is something that I've also participated in as well in all this spare time that I have, which is not very much. And the idea behind that is to basically get them to hospital as fast as possible. But I had not made it to any of the closer hospitals because I was treating people in the field. But from what I was hearing from all the ambulance people, was that Soroka was completely overwhelmed, and they were trying to distribute as much as possible. So the helicopters were coming, from south, that were trying to spread out to Tel Aviv, to Jerusalem, and in Hadassah we got a decent amount, but obviously it was an overwhelming experience on October 7th until they were able to further distribute. But they did the best they could in very subpar conditions.
How long is the journey, the field to Hadassah?
Hadassah from Gaza is probably about a 15-minute helicopter ride.
15-minute helicopter.
Yeah,
and
15.
And Soroka is presumably slightly less.
So Israel's a fairly small country, so the transports happen pretty fast. Usually, the advantage of helicopters, it's very hard to work inside of a helicopter. I can say from experience, there's limited room and limited. You can do your life-saving things on the ground, and you can also do them in the air, but it's much more challenging. The advantage of a helicopter is to get them there faster and to be able to distribute patients to other areas. To get to Soroka was about a 30-minute drive, a 35-minute drive. Also Barzilai, so you were having significant transport times, but people were just moving. One of the good things, the roads were empty on October 7th, so people were able to get there quite fast. And I could say that people were driving well above the normal speed limits.
One of the questions about ischemia reperfusion raises the question. You haven't mentioned there weren't attempts, as far as I can judge, to set up intravenous at the periphery. Some of us are old enough to remember when that was a fashion in such in trauma situations. Was that happening or not? Or
so we would put a large bore IV in everyone, but most of the literature nowadays very much strongly encourages not to give large amounts of saline, which is actually quite bad because it messes with the coagulation factors. One of the things that we saw that was invaluable was plasma, and everyone was running around trying. Basically, the army was the only one that had the plasma at that point, and it was like the hottest commodity there. Everyone wanted, because there were a lot of people that were hypovolemic and needed treatment. And this is something that came in afterwards. Is a lot There's there's this company that does this fresh dry plasma in Germany that donated a lot of plasma following October 7th. But it's something that's definitely, been a larger discussion within the pre-hospital care.
Are you, kind of, we're very privileged to have heard you talking tonight. Some people are asking the question, obviously, have you been asked to broadcast this message in a wider sense? Is Israel going to, we spoke earlier amongst ourselves about the question of the fact that this goes on to YouTube with the association. But has anything been done about a wider?
So I've had the opportunity, I've done multiple interviews on CNN, on NBC, on ABC, Epoch Times. Unfortunately, I've had a lot of interviews over this time, and I think, I don't have a lot of time, but I really believe in the importance of expressing this to the larger world. And I think it's important, I've heard people I'm sure we've all seen and heard people denying it, of what happened. And I think it's important, to spread the word, to understand that, yeah, this is something that really did happen. And yes, there really were atrocities. And yes, we really need to speak up and say this is unacceptable. And therefore, I think it's, I think it's beholden upon me to take the time to explain this and to say the story that I have experienced.
We normally try and sorry, yes.
Shlomo, can I, David, can I just say one more thing before you wind up? Is that okay?
Yes, sure.
Firstly, I echo what you were saying, how humbling it is to hear Shlomo's or Stuart's experiences. And one of the reasons why I asked them to speak was because I know that it comes across so powerfully. There were many failures on the 7th of October in Israel from the military perspective. One of those, I think, is that the triage, not at Shlomo's level, but at the higher level, directed almost all of the wounded to either Ashkelon or to Soroka. I think Soroka got 800 wounded. So in this, what I think is going to turn out to be a 3-part series, next one, which is I think going to be on the 9th of January, which you're probably going to mention, is going to be another anesthesiologist from Soroka who is going to be explaining the view from the trauma bay in Soroka as they are overwhelmed by the incoming wounded, running out of blood and other equipment. And clearly there were shortcomings in the way these wounded were distributed. And then I think we're planning to set up at the beginning of February. You talked, Shlomo, about the 669, the 669 Airborne Rescue Unit, which I think in a kid growing up in the 60s in England would have thought like Thunderbirds. They are the Airborne Rescue. And so we have someone who will be hopefully able to talk about the 669 service working as a doctor, both on the 7th of October and also during the Gaza war.
Well, thank you. Thank you very much. And thank you for the effort that you're putting into this, which is much appreciated. What I just to conclude was to say thank you for this. As Yehuda said, it's a humbling experience, but it's also in its own kind of way an uplifting experience, because it does show the buzzword is resilience in medical practice, but it shows not only resilience but a degree of commitment which we really try and encourage. And we never know whether it's going to come out and how it's going to come out amongst ourselves or amongst our colleagues. And yeah, it's come out in a quite remarkable kind of way. So thank you very much, and we hope that you're able to continue to have quieter consultations and discussions with Shlomo, with Yehuda over the next couple of months and years. Thank you very much.
Thank you very much for having me. Appreciate it.